we decided to bring together groups of nurses, doctors, pharmacists, nutritionists, physical instructors. We brought them all together. We took our army of people and we went around churches and we went around community centres and we did screening. And we have screened, and I wrote the figure down, and I think it's almost 4,000 people. Since 2017, we have screened.
I'm glad I went to this program. It teach me a lot, as well as in my family, in my personal life as well. My family, they suffer a lot with high blood pressure and diabetes. And they don't take anything until the end that they've been ill, they're sitting down, they can walk and everything, and there's no enough time to treat it. So everybody who's gone in my family is just diabetes, high blood pressure, diabetes, high blood pressure. So this gave me a really good platform and opportunity to teach my family as well.
And I'm really, really grateful to Cahn for giving me this opportunity. And also I'm very grateful to John, who has always been looking after me, has always made sure that I don't miss the Zoom trainings. Please for keeping asking me, how are you today? How are you doing? Every time I lag behind. So I'm really grateful to Cahn for organizing this. And I intend actually to give 5 to 10 minutes to cardiovascular health issues in every meeting that we have at Eritrean community meetings from now onwards.
Again, we're a community whereby we believe in everything's faith. There are things we don't need to pray about. We can manage by ourselves. So Kasih has been a part of it's been a part of me that is impacting life around me. I've learned a lot from the lessons we had. You know, when John told me about Kasih's project, I was excited in the spirit, because not only that I'm a pastor in a church, I work in the community. I have done church pastoring, and also I work with people in a homeless situation. So I see life events, I see people suffering from ill health because of partially what they eat. They are causing their part of the problem. So, but due to you don't have enough information, you are limited in knowledge on how to deal with that area. So we resort to prayer and fasting, and I'm being real. So, but the fact that I get involved with Cahn, get involved with Kasih program, I was able to be empowered and informed. And now I'm using the knowledge I've acquired from the training to impact people around me.
I meet a lot of people from my barber shop, and through this training, I've learned a lot about my well-being. I've learned how to manage my blood pressure, my salt intake, my fat intake, healthy living, healthy eating, and everything. And I want to use this platform to help my community, to help the people around me. I've recently lost 2 of my friends through cardiovascular disease. And I want to use this platform to let people know that they should be able to look after themselves well, to take it serious, because this is a silent killer. We've learned a lot here. I've met different people, and we share a lot of experience, and which I want to share with people. So I will now be streaming it live on my shop every Saturdays morning. I'll be giving leaflet out and educating people about this issue.
But most of our people, they are depressed. They could not think about healthy cooking, and I just open up their mind, whatever they have got in their hand, to cook in right way, because personally also I'm a chef, and also since I learn about a lot of courses, training, just informing them. We at least 2 or 3 times a week I work with health improvement team. We're running women and children. Men, I organize, they play football. Children also, at the same time, they do cricket and rounder.
So Cahn has really helped us, given us the opportunity to hear from other people, and these are the knowledge we are trying to pass to our own community. In our own church, we have monthly meetings regarding health. In both, we have for the singles, we have for the married, so that we'll know the exact thing that you need as individual. And one thing that pained me most recently is a friend of mine that passed away not long ago. And what happened? He had an accident, and he just assumed that he would be fine. And some months later, he died, because he refused to go to the hospital and let them help him. So these are the things that we should try and press more into our community. Don't shy away from it. Come to us, speak to people, let them understand what the pain and where the pain is. Because if you don't speak, you will die silently.
Primary care services are at where they're at, and I suppose we've got to come together as a community to make a difference, because if not, nothing's going to change. And it's great projects like this that start that process of change. So it's great to hear from many communities that I can see around the table here today. So just want to say thank you very much for all the hard work and dedication that you've done for this program.
So massive thanks everyone, and it's a real delight, and I hope your journey hasn't come to an end. I like the different expertise, including the barber. You would have many people, whom will come to you, and they will trust you. And it's that trust you have, whether in the church, in your sphere of influence, that is what we want to harness, so that it's not one person being a gatekeeper, but collectively we can influence and have a wider reach. So massive thanks for all you've done. And although certificates are being issued today, I'm hoping that, the team can follow up with some, little tokens or vouchers just to say thanks. And then once again, in a few weeks, we can get together and explore the next steps. Thank you very much.
Ladies and gentlemen, I want to take this opportunity to thank you so much for coming in this morning. It's a pleasure always to have you. This morning, I will do some introductions before we go straight away into the program of the day. My name, once again, I'm John Alex Muita. I'm a program officer with Cahn. And myself and my colleague Peace will be swapping to moderate today. The announcements I want to make, first of all, is our toilets, if we are going to use them, just right through on my right. We go straight through the hall, and we have the gents, the ladies, and the one for disabled. Today I've been reliably informed there are no fire drill practices. That's what I was told. So if the fire alarms go off, maybe it's real. So if in case it happens, the main entrance to use is right through there. And then we go to the pavement at the car park. That's the collection point. As I said, myself and Peace, we should be around to moderate, but we have all the other staff from Cahn who will be helping in case any of you has any question or two. But at this point, permit me to deliver our colleagues who are on the way. They have told us to deliver the message that some of them are running a bit late. They have indicated, but it's a pleasure to have you. So our running order, just take you through. We shall have the opening remarks, and then we shall have a speech to tell us the history of our program, Kasih, what it is, where it came from, and where we want to go. And then we shall have also looking at the approach itself, Kasih, why it was developed, and why we wanted to involve the community at this point in time. We shall also have testimonials from the ambassadors who have started and are on the ground doing whatever they are doing. And we shall also have the presentation of the certificates. And then we shall have networking and refreshments. And then we shall have group photos and others, as you will see. And we shall have closing remarks. And then the others will follow as we depart. Once again, thank you so much for coming. So at this point in time, permit me to take this honor to invite Dr. Faye Bruce. She will give us the opening remarks, and then we shall be informing you what comes next. Dr. Faye.
Do I need this, actually? Do I need the mic? Okay. Good morning, everyone. Nice to see everyone, and welcome, as John said, to this Kasih celebration. It's just been a great year, I think, for Kasih ambassadors and for Cahn, actually. This is a real, celebration, a brilliant programme, and we just want to give some credit to it, and to yourselves. So thank you all for coming. I'm hoping that there's more on the way, because we want to give everybody their certificates today and celebrate them. So just a little bit, there is a PowerPoint coming up, but I'm just going to talk just a bit about the history behind Kasih, because that's just important. So we all know cardiovascular disease is a big problem in the black community. It's not a hidden fact that we are 3 times more likely to have a cardiovascular event than other population groups. And it was only really in 2013. So I'm a nurse by background, so that's what I did. I did my nursing degree many, many moons ago. I don't want to say how long anymore. But I was one of the first degree nurses in the country, actually. So we now know it's all degree to do nursing. But there was always a expectation that people that did the degree would go into management, they would go into research, they'd go into teaching. So of course I did both. I did research, I did teaching. But when I was in practice, and one of the things that propelled me to be a clinician in the first place was just because I was seeing lots of awful situations going on. Being brought up in the black church, used to go to New Testament Church of God in Manchester, a huge church. And it was all the strokes and the diabetes and the amputations. It's kind of like, well, what's going on? People were young as well. And that's what made me go into nursing, to be honest. I wanted to see what was going on. I wanted to help and support. And then going in to do my degree, it was very, very much about, well, we're actually in the clinical area, and the care was pretty abysmal towards people, actually. And you'd go on the stroke unit and you'd see lots of, people from our communities on there not getting the care that they needed. And because the practice was bad, I wanted to do something to prevent that practice from continuing. Sometimes it's a bit like, it's a bit late, isn't it? When you already got clinicians practicing, you want them to practice better. So what do? You actually go into teaching. You go into teaching because you want to affect the changes. You want to teach students before they qualify how to care for people properly. So that's what I've been doing since 2002. I went into to teach nursing at the university. So I was doing that for a long time before doing my master's programs and going into public health. So I'm now a public health specialist, and I develop public health programs because, of course, Cahn is public health. That's what we're about. So it was the work that I was doing at my master's level that kind of made me want to do to focus on CVD. I focused on CVD. I said, well, actually, we've got all these issues around strokes, we've got all the issues around diabetes and all the other things. What's causing it? What's causing these things to continue? We could see some huge improvements in the white communities. Couldn't see it in the black communities. So what's going on? And that's when we brought people together and we asked the questions. We looked at public health information, saw that it wasn't speaking to us. You've looked at through Kasih, the Eat Well guides, the nutrition, the information that's given to us, and we say, we don't eat baked potatoes and beans. You can't tell us to eat that when we go to for a diabetic check. That's not what we eat. What about what we eat that's going to make a difference to improve or prevent diabetes and obesity and all those things? So Cahn was born in 2017 and it was very, very much focused on CVD. But I always say CVD is emblematic of a health inequality. If you have a cardiovascular disease, that says so much about your health. I mean, you can link it, can't you, to lots of other things, whether it's, if you've got diagnosed with cancer, CVD is going to impact. If you think of mental health, CVD is going to impact. Whatever you look at, it's going to impact your overall health and well-being. So that was the focus on CVD. Kasih was very, very much part of that. So immediately what we did in 2017, with the help of people like June, who was volunteering for Cahn at the time, we decided to bring together groups of nurses, doctors, pharmacists, nutritionists, physical instructors. We brought them all together. We took our army of people and we went around churches. And we went around community centres and we did screening. And we have screened, and I wrote the figure down, and I think it's almost 4,000 people since 2017. We have screened. But unfortunately, of those numbers, we have had to refer over 40% of people from our community because they have high blood pressure, atrial fibrillation, which I'm going to test you on whether you know it or not from your workbooks. Atrial fibrillation, things like diabetes, we're just starting to do the testing for that now as well. But we have screened a lot of people. We've educated thousands of people, whether it's through going into churches. So what we did at Bethel, which we were really grateful to do, is to be able to have a clinician talk to communities, talk to congregants about CVD and try to engage people in better CVD health. So that's what Kasih was all about. Kasih was using what we were doing in 2017, but actually looking at how we create or develop the health literacy of people that run barbershops, work in churches, lead community centres, working wherever there's going to be some attraction of our communities. Where can we build the health literacy for those people? And we call you ambassadors. So that's where it kind of came from. That's the history of Cahn in a nutshell, and also Kasih. So today we are here to celebrate the first cohort. That's our vision. And it's very ambitious. It's very, very much about how do we end health inequalities for our community within a generation. So you can imagine, we have a long way to go. We are so far behind in terms of addressing, bringing equity in terms of our community. So it's very ambitious. We have all of these objectives. And one of the beautiful things about when we first started, we had a bit of a peg up because we were all, the people that formed the board were all kind of in spaces where we could really affect change, engage with our strategic partners. So with devolution, we got right on it and we said, we want our slice of the cake. There was £6 billion that was going to be disseminated locally for the whole population in Greater Manchester. But what we do know is that black communities, black community groups don't really see any of that, very, very rarely. So we wanted to quickly get around the table. So one of our objectives is to work collaboratively. We work collaboratively with lots of community organisations, but we work strategically. We work with our partners in terms of what we call now the Integrated Care Board. We do lots of consultation, we do lots of planning, we do lots of co-production, we do all of that. And then we champion. We really want to champion, you know, our assets. And what you have seen on a Saturday, when we talk about assets, we talk about nurses, we talk about all the professionals that are working to support this initiative. But also, you know, since May 2020, we've been doing health hours. And you know, the number of doctors, you know, medics in terms of GPs, consultants, surgeons that will come on, prepare these presentations, all on a voluntary basis to empower our communities and to help them to become more healthily literate. So when we go to the doctors and we've got a condition and somebody's just spoken about, I don't know, hysterectomies, and you've been sat in on that workshop and that doctor has told you, actually, there are more choices for you than what you are being offered. You can challenge those doctors. It's all about empowering our community. So we can do for self and we can self-manage and we can demand better care from our clinicians and services. So Cahn, I don't really need to go through why we exist, but basically we know there's been a lack of trust. We know there's been poor access. We know, and it's not just access in a doctor's surgery. You know, it's about when we do access, what is the accessible information that's tailored towards our needs? What is that? We know that there's poor engagement. We know we go late. You know, when we do the health screening, and June will tell you, we go around and we do the health screening and we have to really pull people to come and get screened. And people are saying, I just don't want to know, I just can't know what, just in case it's high. And people worry about that. And people for years have put off going to their practice, their GP practice, because they don't want to hear bad news. Nobody wants to hear bad news. But what we keep on saying is go early, engage early. There's more likelihood of something being done if you catch it early. So we try to change that poor engagement. Inadequate knowledge of research, and I can just say that when I started my PhD at the university, as big as the university is, there was no one to supervise me in this particular area of practice. So I had to create an institute, a research institute, which was based on race and ethnicity, to pull people in from outside of the university, to really bring a body of knowledge to the university. And now what we see at Manchester Met is a whole research on race and ethnicity, which is absolutely wonderful. I need to shout about that a little bit more, actually. but yeah, it's just the body of knowledge around race and ethnicity and health is really poor. And also shouting out about racism in health. That was something we weren't able to do. And I remember one of my supervisors saying, oh, well, let's change the focus. Let's look at eating, healthy eating, rather than looking at some of what we knew were the issues was racism. And some of the challenges that we've had, if anybody's ever heard of Michael Marmot, he's the most renowned public health expert, probably in the world. Anybody, if you go to any public health, whether it's the World Health Organization, Michael Marmot is there. Michael Marmot came to our office at the back end of 2019. He met with myself and Charles. And he said, I asked him, so he came to talk to us about Cahn, what we were doing, because it's public health. And I asked him, why is race, and you've done determinants of health, haven't you? You've done that in your Kasih program. Why is racism not a determinant of health? Why is that not one of the factors that can create inequity in health? He said there's no evidence for it. There's no evidence that racism is impacting upon the differences, the disparities in health for black people, or even ethnic minorities in general. As we know, 2020 came, we had the pandemic, and there lay bare all the inequities around what was racism creating those disparities in COVID. If you look at his paper now, racism is the determinant of health. So again, it's about how because we have those lived experiences, we know, we experience them. So when and this is part of what I want you to do as ambassadors, is challenge the system, challenge your GPs and your clinicians, because we have the lived experience to be able to say, this is what it's like actually, this is what it's really like. And the biases and the benchmarking, that happens as well. So again, when we look at the benchmarking, I've shared about the healthy eating guide. It's not benchmarked, it's not appropriate for us. Not some of us it might be, but for the majority, when we talk about cultural eating, it's benchmarked to white majority populations. And I'll tell you this, and I don't know if you know, the pulse oximeter. I don't know if you've ever seen the pulse oximeter, the probe that you put on your finger. You go to the hospitals and you get your oxygen levels checked. What we discovered in back end of 2021, was that probe doesn't detect the melanin in our skin as well. So when you put the probe on, it actually gives a false reading. So the reading doesn't actually detect how much oxygen's in your blood. Going through COVID, what was it that was actually causing us to die? Lack of oxygen. So all of these things are being, mostly since COVID actually, and since George Floyd, there's been a lot more kind of work done to really pick up on those benchmarks, on the things that are not meeting the needs of our communities and causing us to have more morbidity and more mortality. And I sit on the Race and Health Observatory, and a lot of work we're doing around maternity and other areas. It's massive. So anyway, moving on. These are the areas that we look at. You can see cardiovascular disease is there. It's been there since 2017. And all of these things link in one to another. So, and also, if you think about, do you know about Core 20+5? I won't go into it, but it's just synergy. It just shows synergy, doesn't it, between what we're doing in Cahn to what's being done on a national footprint. So, anyway, right. So this is what we've been doing. Improving health literacy. I'm hoping you can say that we've done that with Kasih and the ambassadors and the workbooks and things. We're looking at, this is our health and wellbeing provision. So we're looking at health literacy, we're looking at culturally appropriate provision, and also we look at policy and insight. So we're really changing and looking at the national policy frameworks. These are just some of the services that we've got. You may know about them, but just even for your own knowledge and just to disseminate that for the communities that you work with. So we've got a range of them, and I'm not going to go through all of those projects. But you can see that Kasih is there as one of the health and wellbeing. It sits in this department. But there's lots of things that we do there. If you just go on to the next slide. Okay, I've talked about this a little bit already. I've talked about the context for CVD, why we're doing it. But that's what it costs the economy every year. 22 billion, over 7 million. But what we do know, we're more likely to get it. So you can think about the expenditure on black health, okay? And we're also more likely to get it at younger ages. So when we go out to churches and we do all these screening, and this has been my bugbear, age 40 is the health check, isn't it? Okay, so we know from our own screening, we'll pick up hypertension in people that are in their late 20s, early 30s. You're not encouraged to go for your blood pressure monitoring, are you, until you're 40? If you think about the damage that's causing with living with high blood pressure when you're young. Yeah? And I'm not going to go into an anatomy and physiology session, but you can just imagine the damage it's actually causing. So what we've been advocating for is doing screening earlier. And what we do say on our health hours and things is just go and demand. Get your own blood pressure monitors as well, and just demand from your GPs that they follow up with checks. There's no more of the days when they'd say, oh, you're not old enough for a health check. Not old enough for a health check, but you do need to push to have those done. Yeah? So, right, so this is all the history of Kasih. This is all Kasih, all CVD related. If you just go on to the next slide. Okay, so this is what we planned to do. This is what we wanted to do. We wanted to bring to Salford this project, looking at health literacy. We have done 1,200, we wanted to impact at least 1,200 people, and we know we've done that. Screen 500 people as well, so when we've gone out and we've done the screening. And also, one of the things that we weren't able to do was the long COVID, but that's absolutely fine. We know some of the reasons for that. If you just go on to the next slide. So these are some of the interventions. One of the things that I'm not sure whether you did much of was the creation of some of those resources. You know, some of the leaflets and things like that we wanted to do. So hopefully we'll start to look at how we can create some of those messaging for your own communities. Okay, just if you go on. So we do have 12 ambassadors, which was the plan. To have 4 in churches or places of worship, barbers, hairdressers, and community leaders. So whether that number is exactly the right, you know, in terms of the configuration, it doesn't matter. We have 12, which is brilliant. Okay? And this is the education that you've had. You've had all of that around CVD, prevention, screening, atrial fibrillation, and of course you've been attending the health hours as well, so that's all been part and parcel of that. Okay. And these are just some of the flyers, or one of the flyers. Is that it? Yeah. So, I'm going to end there. And I think what would be really great to have now is some testimonials from yourself in terms of, you know, what... I think you've had some questions, haven't you? You've had some areas to look at, and we're going to gather some learning. But if I can just say this bit first before I sit down. We want Kasih to roll out across the country. Yeah? We want to have a Kasih in all regions of England, certainly to start off with. So we want this to be a pilot that's worked, in terms of building health literacy, how you've engaged with your communities as well, to encourage them to take up screening, just to engage with healthy eating. So you had nutritionists, didn't you, come and talk to you? You had pharmacists come and talk to you. You've had sessions on how to read a blood pressure and things like that. We want this programme to roll out. So next week at the NHS Confederation meeting, we're going to be selling Kasih. So we'd love to hear your testimonials about what you've achieved, what you've benefited, why you did it, all of those different things. If we can hear from you today, and so we can use some of that. So we just really want to celebrate what you have achieved, because it is a lot. Right, so I'm going to end there and just invite, is it yourself, Peace, to come and do this section? Thank you.
Thanks, Faye. Yeah, so just as Faye said, right. Yeah, so my colleague had just reminded me that it would be good for us to know who we are. So maybe like just go around to, for everyone to say, introduce themselves, so your name and then where you're from, just so we know who you are. And then afterwards, we go to the testimonials. Is that all right by everyone? Right, so are you happy to start? Brilliant. Yeah, nice to meet you. Next person, please. Angela. Dr. Peace has said, I'm really, really grateful. And it's like a challenge now to, what she has said, because our communities really, really need enlightening. We really forge ahead and make sure that, there is an impact. Thank you, Dr. Faye. Thank you.
It's a pleasure to be here. My name is Pastor Carlo. In fact, it's a privilege because this is the hall we use for our services. And I thank God that we have been a part of this project. And I believe strongly that we are going to do better tomorrow and address some issues within our community. God bless you.
Hello, everybody. Good afternoon. Good morning. My name is Deborah. I'm from Salford. I'm a chair of the Salam and Amharic and Tigrinya Homework Club, which is supporting Ethiopian and Eritrean community in Salford and Greater Manchester, and cooking Ethiopian and Eritrean food. Welcome, everybody.
Good morning, everyone. My name has not changed. My name is Ebenezer. I'm a member of my father's house, is a community, and we help the students coming in to integrate more in the community and to make them feel welcome. Thank you.
Good morning, everyone. My name is Daniel. I'm a member of Cahn, and I say my role in Cahn is a boys' club to engage the young boys going into men in activities, workshops, and so on. Thank you.
Once again, my name is John. I work with Cahn. Part of what I do is community engagement work. I'm proud to be part of this community. And we started the discussions on Kasih. I visited the churches, I visited all these places and those businesses to talk about this. I'm so happy to be here. Thank you.
I'm Michelle Williams from Bethel Apostolic Ark Church, Tetlow Lane in Salford, and I am pleased to be here also and to have the opportunity to learn and to be with each one of you today. I've brought my sister along today, Janet. So thank you for welcoming us.
Good morning, everyone. My name is Jasmine. I'm a founder of the community group called Women with Wings. We're based in Little Houghton, so today you are in my territory, and welcome you all. I'm glad I've joined the Kasih. And I'm happy to be here, seeing each other face to face for the first time. We've been in a Zoom meeting for quite a long time. So thank you very much.
Yeah, good morning, everyone. My name is Dr. Sakina. I'm the head of Health and Wellbeing Department, Cahn, and I'm so proud of the landmark achievements you've all made, and I look forward to you making resounding impacts in your community. Well done.
Thank you. Thanks for the introduction. My name is Peace Yamja, and I'm the Health and Wellbeing Development Manager at Cahn. So I think the next session we are going to is testimonials from Kasih ambassadors. And like I said, no, I don't want anyone to fright or to feel like I've not done enough. And we want everyone to share what you've been doing in the community. I think I sent some guides as to what you could say. So we would want you to share your learnings from the training and the benefits you got and how it benefited you personally and how you've used your learnings to impact in the community. Learnings from the health hour session and also from the training sessions. And then what are the next steps? What have you been involved with? What kind of engagement have you had with your community, family members, people in the community? And then what are the next steps? What do you intend to do with the knowledge you have? So I wouldn't want to invite everyone to come forward. I think I would do you the honor of going around with the microphones if that makes you feel more relaxed. Kasih ambassadors. So who is happy to volunteer to start first? Brilliant. So we just checking, is everyone happy for this to be used for publicity and to get your content? Happy for this to go on our website, to be sent to the commissioners and all of that? Everyone happy? Yeah, that's fine, that's fine. So who is happy to start? Michelle. Let's clap for her, please. Let's clap for her.
Good morning again. The Kasih training has been useful for me to reflect and to bring out necessities and health support. When we were going through the training, there was quite a bit that was spoken about, and we try and implement it on a daily basis, making sure that you take your medication. And if you're not taking medication that is prescribed, well, then you have to be consistent and persistent with the alternative. But you can't just leave your if you've got a health issue, you can't just leave it untreated. You need to do something. And there's, so encouraging others to do the same. The health hours, what we've been doing or what I've been doing each week when it comes through, I share it with the church, share it with other communities, and there is other chats that I'm involved with that's not in Manchester, and we've shared it out. So what is some of the feedback that comes back, I do sometimes send it on to Cahn so that they can see the impact that it's having on other communities outside of Manchester. So we are reaching further afield than Salford and Manchester, the Midlands and London and Nottingham. So it's going further afield. We have had our health session where the team from Cahn came in and supported screenings, and we are hoping to do some more. And I was just talking about doing something on a more personal level within the church, that we, even if it's every 6 months or every 3 months, we'll take the blood pressure monitors down and check, because we do know that there is some with the blood pressure problems. We also, so the Cahn presentations have been invaluable, and teaching and learning the different sicknesses and what you can do to help yourself. So it has been useful, and I'm glad to have been able to have the privilege to be a part of this Kasih, that we can support one another, because life is for learning, and we have been learning. Thank you.
Is that okay? Talk without it. My voice is bad. Good morning, everyone. I hope you can hear me.
Jasmine, do you mind coming up, please?
Oh, no.
Because I was just told that it's better to use the background.
Just because we can catch you on your own, darling. And here.
Yeah.
Oh, Susie, I am very tired. Yes, please. Oh. I need to make up then. Lord. So this one can be seen. That's a good capture, oh Lord. And that's how down it can go. Okay. Okay, good morning, everyone. As I introduce myself, my name is Jasmine. I've got a women group called Women with Wings in Little Hulton, just about 10 minutes from here. So before I joined CAS, I've been running my organization since 2017, and my aim is to help BEM women to improve their life from one point to another. So due to the nature of the women with the kids and all the commitment, I aim them to go to start small businesses. So what I was doing is to flourish what they've got, what their passion into business. Going to do that, many women, as we know, we've got a lot of baggage. So every woman comes, they've got this issue, this issue, this issue. So my job was to go to those issues and minimize them before I led them to go into their journey of starting business. And one of the issues was healthy. Many of us, we just eat what we want, we just eat wherever we want, and all those things. So I used to work, I'm still working with the Salford Health Improvement Team. So every 3 months they come and check the healthy with the blood pressure, cholesterol and weight and everything. And after that, oh, your blood pressure is high, you have to go and see GP, call your GP and go on. None of them, as soon as they finish, take the paper in the bin. Not going to see a GP, I can walk and things like that. So when the Kasih come, Kasih empower me to be able, as soon as they drop that letter in the bin, I pick them, on the side, look, this is why you have to do. You have to go and do it because you are fine now, you are working now, but that is going to impact you in the later life. That will be bad, and this is what bad is going to get, and then the life will change. Then you're not going to be able to look after your kids, not be able to look after your house, after your home, all these things. So I'm glad I joined the program because, first of all, I was telling Lesmond was coming to me, oh, Jasmine, we've got this. I said, I have got no time. I am so sorry. I'm very busy, don't have a time. Oh, you think about it and come back. And I say, you know what, by the time it's the deadline, I'm out of the country, so you can go ahead. Come back and oh, Jasmine, the deadline, we scrap that, but we still need you. I say, oh God. I say, all right, I'm coming. And then I had a problem with the piece, with the date. I say, I can do this, I can do this, I can do this until we get the date that I can do. So I'm glad with all the struggle that come into this program. I'm glad I went to this program. It teach me a lot, as well as in my family, in my personal life as well. My family, they suffer a lot with high blood pressure and diabetes. And they don't take anything until the end that they've been ill, they're sitting down, they can walk and everything, and there's not enough time to treat it. So everybody who's gone in my family is just diabetic, high blood pressure, diabetes, high blood pressure. So this gave me a really good platform and opportunity to teach my family as well. My brother is on that high blood pressure already. They are quite young, not even 45 yet. They're still on there. Myself, I'm diabetes as well, type 2. And even the doctor say, well, we can't see. I say, wherever it is, I am in there, so let's go with it. So the Kasih give me that opportunity and the education and to teach myself, to teach my family, my community, and everybody around it. So I'm glad I joined. I'm glad and I got all the education, and I am using it to all my family, my community, my ladies, and now the ladies, all of them, because it's a small community and we've got just one GP. Everybody, they can tell somebody to come out of the phone, I want an appointment with the GP, and the GP is quite, the phone is quite busy. So all the ladies, they're quite happy to go to the GP, speaking about everything, about their health, about their kids' health, and all this because of the power that I got from Kasih. Thank you.
Good morning, everyone, again. My name is Sarah Obai, and by profession, I'm a linguist and language assessor at the University of Manchester. But I'm very much interested in community services. And I am also a co-founder of the network of Eritrean women, both the global and also the local one. Women's health has been a priority to me because of domestic violence, because of lack of education, lack of awareness, mental health, these heart issues, diabetics, and so on. Women are the core of the society. So if they are well, everyone can be well. If they know how to look after their family, then the family will be well, the community will be well, and the society will be well. So along that line, I have a colleague at the network of Eritrean women. She's a nurse. She's a nurse, she's a health visitor, and with her education, we've been teaching women how to be healthy. And most of the things that cause health issue with women come from domestic violence, unhappiness, mental health issues, stress, panic attacks. So this has been one of the things that I have been working since 2013. But after I joined this training with this Kasih, I really, I can't say how blessed I am to have more knowledge on the consequences of palpitating hearts because of panic attacks, of uncontrollable panic attacks. The fact that when people are stressed by other things, they resort to food. So in our community also, one of the things is that when people become a little bit bigger, it just means that they are doing well. They are happy. So that's what we see. In fact, it's the other way around. So these are some of the things that I have been stressing recently. So at the moment, I am the chairperson of the Eritrean community in Greater Manchester. So this also gives me the opportunity to meet many people. And also I'm working on culturally appropriate mental health, especially with asylum seekers. So when asylum seekers come here, one of the things that happens is that they have been deprived because many of them come through the Sahara Desert, through Libya, through a lot of misery and trauma. So when they come here, they look at food and they're happy that there is the abundance of the food. So they eat French fries, food that is not healthy. The fact that they are at peace and also the trauma, they are trying to get over it. So they resort to food. So with this mental health, I have been going around to some hotels with other organizations like Lingua GM, And as for SE, we've been working, going from hotel to hotel and just letting them know about, talking to them about how they are feeling, living well, being well, living life to the full, and so on. But I've always also focused on the way they eat, because because of, if they don't do that, the consequence is there. The consequence is diabetes, the consequence is high blood pressure, the consequence is, heart attack, stroke, and so on. So this is something that I have been doing, and I'm really, really grateful to Cahn for giving me this opportunity. And also I'm very grateful to John. John, who has always been looking after me, who has always made sure that I don't miss the Zoom trainings. Peace for keeping asking me, how are you today? How are you doing? Every time I lag behind. So I'm really grateful to Cahn for organizing this. And I intend actually to give 5 to 10 minutes to cardiovascular health issues in every meeting that we have at Eritrean community meetings from now onwards. Yeah, thank you. Thank you.
Good morning, everyone. As I said previously, I'm very much delighted to be here this morning, and also I am very happy with the work Cahn and Kasih, is doing. And I came in contact with Cahn through my husband, because he was the one that was linked up with John. And at the time, I started joining the forum, and especially during the health Zoom meeting. Personally, on a personal level, that is the biggest take, because I believe that you can't give what you don't have. So looking at the acronym of the knowledge, I would say that being self-aware about how important to manage your own particular health, and be able to also manage or kind of have an input around the people, into the lives of the people around you, because we work with the communities. We are a church, and we also have we've invited John, who wants to come and speak within our meeting, and I know that it was very impactful. And also, we have a business somewhere in a very, I would say many people from ethnic minority, they live there. And lately, a young man, because somebody can have like cardiovascular disease at any age. I was quite saddened when a young man should be in his maybe late 30s walked into the shop recently. And I thought his limping was just basically maybe he had a strain or somewhere. But at the end of it all, he told me he just had a stroke. And tears were, and he's from the African, background, and he has a little child. So it made me think, and I think it's not a coincidence that I'm here. But one thing I would say is that the knowledge, the self-awareness, that especially the propensity or the tendency, the higher tendency that we have to, we are more likely to suffer diabetes and all the rest. So the big take is to be very much, as I said, aware of my health during all the Zoom meetings. And the challenge now is to be relevant to my community. It's not just, being relevant, being able to do something. because it takes a trickle of water in order for it to spread. And the resources also, because, the resources during the Zoom meetings when we come online is very, very educative. So I will say, generally, for me, the best take is that, power to know. Knowledge is power. And then to be able, the step that I will for my own community is engagement, and also basically bring forum where people can really, because people don't know. And what you don't know is most likely to kill you. Sorry. What you don't know, but the pastor in me. So I will thank God for Dr. Faye and all the rest. What you're doing, you may not know it, but it's going to really, it's like a cascading effect. It's going to really touch our community, and I'm proud to be identified with Cahn and Kasih. Thank you so much.
Bless you all. In fact, I'm pleased to be here. I thank God from the knowledge you have acquired through Kasih. I came from a community where we believe that adding weight is a part of being successful. Let me take it that very well. So if you're not overweight, they believe that you are suffering. That's the community I came from. So, and they were being also in the ministry, a lot we don't take our health seriously at all. We believe, again, we're a community whereby we believe in everything is faith. But there are things we don't need to pray about. We can manage by ourselves. So Kasih has been a part of it's been a part of me that is imparting life around me. I've learned a lot from the lessons we had. When John told me about Kasih's project, I was excited in the spirit, because not only that I'm a pastor in a church, I work in the community. I have done church pastoring, and also I work with people in a homeless situation. So I see life events, I see people suffering from ill health because of partially what they eat. They are causing, they're part of the problem. So, but due to you don't have enough information, you are limited in knowledge on how to deal with that area. So we resort to prayer and fasting, and I'm being real. So, but the fact that I get involved with Cahn, get involved with Kasih program, I was able to be empowered and informed. And now I'm using the knowledge I've acquired from the training so to impact people around me. Like my sister said rightfully, I had people also in my family that have issues with health issues that are related to high blood pressure, diabetes. But due to you don't have an informed knowledge, you can't inform them properly. But now Cahn, the program, have empowered me. I'm now informed. I'm now in better position to advise you before supporting you with prayers. So honestly, I'm glad we had this opportunity to be a part of the project. So, but I think the next point I would like us to go through, which I also suggested during the meeting. I'm happy that Faye is here, and thank God the church has come in as well. So it's better we address this issue. What I want us to do is that my sister said it rightfully that we live in a small community, and because of our GP, they are overburdened with health issues. Sometimes to secure even an appointment is an issue. So because of that reason, so we have learned, we have had knowledge, but sometimes I was told during the meeting, during the project, that maybe we can organize a meeting, that people can come in, then we do screening. But sometimes you don't have that time to organize it, because to organize a meeting now, due to since COVID era, when people hear about the health issue, some of them don't even trust the health system anymore. So I think that we have to take this to another level, whereby We are not only informed with knowledge, some of us will also be empowered in practicality so that we can execute these things within our community, not waiting to arrange a meeting for Cahn to come to execute it themselves. That's the areas I want us to address. I've said it in a meeting and I'm repeating it again. If we had all this knowledge, we advise them and set them go to GP and they're not getting an appointment at GP, then we have to arrange a time to arrange with Cahn. It's still the same time with the GP. It's still the same time we are wasting. I thank God for my wife shared a testimony of a young brother who had been in this situation. It's time that led him now he had a stroke. Had it been that he had an opportunity, he was informed earlier, he was treated earlier, maybe he wouldn't get to the last first stage. But he came to that very stage. So please come and thank God for you are here. Charles, you are here. The next part is not only to inform us, let us be empowered to do it practically when Cahn is there, when Cahn is not there. Thank you very much.
In my language, salam. Thank you for your counting me in this big organization. Kasih, I think John is the key person. Thank you, John. For me, you open up my mind or my eye. What I've been doing, but what I have to do for next. Because since I joined this organization, a lot of Zoom meeting. I know you from the small screen, most of you, and I learned a lot about cardiovascular. It was not worried for my personal life. I said every day I eat healthy because I love vegetables. But since I heard, especially one day from Sheffield, one young lady, she was talking. It touched my heart because she was explaining to us a lot of variety things, and which my people, they don't care about fat and oil. And I start talking with my community because my connection is very wide. International. I set up the group Ethiopian and Eritrean background because of the man-made war. We are here since 93. Politics split us, but many people living here in Manchester or Salford with a lot of trauma. They don't care about what they eat, they just eat what they get. And the lifestyle, refugee and asylum lifestyle also, it's not easy to choose what they eat. They just get what in front of their face. But most of our people, they are depressed. They could not think about healthy cooking. And I just open up their mind, whatever they have got in their hand, to cook in right way. Because personally also I'm a chef. And also since I learned about a lot of courses, training, just informing them. Every Tuesday you teach me. Yeah, I put for whenever I meet them. We at least 2 or 3 times a week we do. I work with health improvement team. We're running women and children. Men, I organize. They play football. Children also. At the same time they do cricket and rounder in a local. Park we use and churches, and also sometimes in my cafe. And at the same time, because of my connection is wider, not only Ethiopian and Eritrean community comes, Sudanese, English, mixed race especially, they come and I talk to them. Most of them, they are using, especially reducing the oil And thank you very much for you bringing me here, John. And I'm pleased what I heard from everybody in a different skill. You are here, but it helped me. As I told you, I'm the founder of Salam and Amharic Homework, Tigrinya and Amharinya Homework Club. I'm focusing with family and children, especially, not only women, even men. But maybe if you come and maybe welcome one day to come and visit us. We run the homework club. We teach the children. I teach them how healthy cook. You could not find any obesity from our children because of this, reducing the oil. They are very active, running, playing football, cricket in rounders, and they are very healthy now. I can say very healthy. But of course we need support, we need help. Why? Because of background is refugee and asylum seekers. And when they come here, sometimes, a lot of help from council or other organization. They don't give them the food by choice. They just give what they have. Because of they donate, anybody donates, they just give them. And sometimes they don't know, about what's big fat there, what's protein there. They don't know because of the language. And in the future, I will continue, and I think I need more support because different cases come, different people coming. And I'm very, very happy to continue. For more future, as I told you, focusing with the children, women, and our family in different ways. That's it, I think. Thank you very much.
Good morning. Can we see my voice? Yeah. I just want to say thank you to everyone and everyone that has spoken before me. I'll combine everything you've said together. So you take that in, then I'll add just a few words of mine. I want to say a big thank you to Cahn and the Kasih. One thing I realize is that if you don't have a platform to show what you have, you will be denied so many opportunities. So this is the platform which has been given to us, and this is what we are taking back to the community. There is a platform for you to come out and speak, because if there is no platform, you will only be assuming things, and that's what has been happening to so many people in our community. They just assume, I can fix this, I can fix that. So during the training, we've learned so many things, how you want to manage your medication, how you want to fit it. You want to pray only. You don't want to take a medication because you've seen somebody that have prayed and it worked for that person. But you are not that person. You might pray, it might not work. You might need medication and prayer for them to work. So all this training have helped us because of the knowledge we now have. We have information as well, which is very key. So many people, they don't have the knowledge, they don't have the information, and more bringing it home, maybe in communication. They might want to communicate with you in your own dialect, in the language that you understand more. Because I remember back in London, somebody was arrested because he had so many laptops with him. And they were asking, why do you have so many laptops? He could not express himself. So they have to just say, okay, follow us to the station until they got an interpreter to come and say, okay, I am an IT specialist. This is what I do. So he cannot communicate that to them. So they have to detain him. So there are some things that we want to communicate in more simple language. That, okay, I have this issue with me as a man or as a woman, but because I can't express myself in English, I don't know how to express it. If I have headache, I'll say I have pain. Pain where? There will be pain somewhere. So Cahn has really helped us, giving us the opportunity to hear from other people. And these are the knowledge we are trying to pass to our own community in our own church, we have monthly meetings regarding health in both. We have for the singles, we have for the married, so that we'll know the exact thing that you need as individual. And one thing that pained me most recently is a friend of mine that passed away not long ago. And what happened? He had an accident, and he just assumed that he would be fine. And some months later, he died because he refused to go to the hospital and let them help him. So these are the things that we should try and press more into our community. Don't shy away from it. Come to us, speak to people, let them understand what the pain and where the pain is. Because if you don't speak, you will die silently. And this is what we are trying to push out as community, as Cahn. Try and let them know about the knowledge of their environment and what they are going through. Let them have more access to information, that this is what I have as an issue. If you need an interpreter in your community, get an interpreter. I believe in different community, you have people that cannot speak English, that cannot speak a local dialect. Try and get somebody that can help to interpret, because the earlier we get these things done, the better. Thank you.
I'm sorry I'm late. My name is Leslie Kofa. I'm a barber in Lower Broughton Road. I thank everyone. Thank you all for gathering us together. I mean, I've learned a lot from Cahn, because me, myself, I've been struggling with blood pressure. You know, through this, I've managed to manage my salt intake, and I'm trying to do a lot, even though not everything I've been doing, but it has really helped me, because recently I have two of my friends which passed away. They just go to bed and they never wake up, and nobody knows what is happening. I mean, people are caught up with work, so many things, that we are lacking a lot of information. I think this organization is doing well. Me, myself, I've seen the impact that has made in my life, and I think everyone will learn from it, you know, because not all the information you get from your GP or whatever. Nowadays, it's very hard even to get appointment to go check your blood pressure. I've got a machine at home, but normally it doesn't read it as the way when you go to your GP, how they tell you how to go about it. So I'm really pleased, and I thank you all. Thank you.
Hello, everybody. I'm Michelle Williams from Bethel Apostolic Church on Tetlow Lane in Salford. And I am grateful to the Cahn team for introducing us to Kasih and to be able to go through the program. I've learned a lot, and learned that it is important to take the medication prescribed. I've also understand that if you don't want to take the medication, you need to do something. So if you prefer to do something on a healthy level, you need to be persistent and consistent with it. The medication is something that is on a regular, and it is you have to deal with it, or you'll end up in trouble. I thank Kasih and the team for their input, and for the Zoom meetings, and even the accessibility, because even when we've got questions outside of the training, if somebody came to us, then we can contact the team to ask a question to get further support. So they give us knowledge, they give us access, they encourage with the screening, and we've had that opportunity to encourage others to have screening. And we've also put on an event where we've done screening within our own congregation and community. And it's something that is ongoing, because we have to keep a check, because today we're okay and tomorrow we don't know what will happen. So we have to keep on top of checking our health and making sure that our communities and our families remain healthy as well. So I thank you for your time. Thank you for the health hour information that we've been able to share, not just in Manchester or Salford, but share right across the Midlands, Nottingham, London, so everybody has access. So it is a good thing, And I would encourage everybody, you know, sometimes what's being delivered might not be for you, but you could think of somebody that it could be useful for, so you share it on. And the good thing with the health hour information, it's all on Zoom. So if you miss it, you're not available at the live screening, at the live showing, you can go back and watch it later on. So it is a good thing, and I would encourage Cahn to keep up the good work, continue what you're doing, and we appreciate your support. Thank you.
Thank you, Michelle. Thank you, everyone. So I'll just invite June to kind of finalize everything the ambassadors have said, and afterwards we'll bring our chief officer. So,
Hi, everybody. It is so nice to see you in person, not just little on the screen. It is. As you walk in, it took me a few minutes to think, oh, that's such a body. It's lovely to see you. And thank you also, because being a nurse, it's how do I translate it? How do I struggle a lot with the presentations, because I could tell you all this technical stuff, but it wouldn't make any sense to you. And that's what this is all about. It's about giving you that knowledge on a level that you can understand so that you can use it. So there was no point giving jargon. It was, I hope I kept it simple enough. And listening to everybody today, I don't think even I realised the impact that it's having, and it's been a wonderful occasion. So thank you all for listening when Peace and I were talking on the screen. Just briefly, just to bring it up to date, I went into one of these, these AI things. My son said to me, Mum, why do black people have diabetes so much? So I quickly looked on this AI thing. So I put the question in, why are black people more prone to diabetes? And it came up with three points. It said that we are genetically disposed to it. So it's in our genes that we're more likely to get diabetes, which then leads on to other cardiovascular diseases. It also said that we have poor diets. We don't eat well, and that we're not very mobile. We're not very active as a race, as a community. And this is something that's out there on the internet, and it just made me angry, because the world's best athletes are from our communities. So what's going on? What's wrong? And what's wrong with our diet? When we're eating the food we should be, then we are healthy. So these are things that we need to look at. That's what's out there, but it doesn't have to be how it is for us. We have the power to change that. And that's the whole point. The knowledge is power, somebody said before. And that's what it's about. It's about you understanding and saying, okay, I don't want to take medication. What else am I going to do? And I've learned things as well. Being persistent, being committed, and just, if you're going to do something else, you stick to it, but you keep track of what's going on. How's my health during these different changes? I've finished talking. I'm going to, I know this is quick for me, but I'm just going to introduce Charles. Are you ready, Charles? John, I'll let John introduce you. All right, thank you.
Thank you so much. The testimonials really give that background and the deeper insight into the program. At this point, ladies and gentlemen, permit me to invite our friend and a partner in this from Salford City Council. Just remarks on this kind of achievement to have you having successfully been trained. Jordan Moore. Thank you.
Thank you, John. Thanks, everybody, for your absolutely amazing testimonies of the work that you've been doing in Salford. It's great to see all the hard work that communities are coming forward and recognising needs within their communities and empowering themselves and empowering their communities to make a change and make a difference. I worked quite closely with the City of Praise Church in Little Hulton last year, and we found some quite interesting discussions happening there about the impacts that they see on their community's health and well-being. And it links directly to the work that Cahn's been doing in terms of cardiovascular disease. People were saying to me that they're worried about their health and well-being. They're worried about the risks of heart disease. And it's work like this that helps those communities and those residents to really understand how they can have a positive difference on their own health and well-being. Primary care services are at where they're at, and I suppose we've got to come together as a community to make a difference, because if not, nothing's going to change. And it's great projects like this that start that process of change. So it's great to hear from many communities that I can see around the table here today. So just want to say thank you very much for all the hard work and dedication that you've done for this programme. It's great to see that impact, and that, like I said, the national statistics show that your community is disproportionately impacted by these kind of diseases, and it's so vital important that we get the messages to the right people at the right time. So one thing that I really thought was interesting that I found out quite recently was that a number of our communities go back home for their medication, and they get the medication and they either don't know how to take it or when to take it, which was what was discussed earlier, of not taking it in the right way. So it's great that these programs are here to inform people that when they get given medication, make sure you take it in the right way. And if you are getting medication from back home, make sure you're reporting it to the NHS, because if you're going to the NHS and asking for other medication, that might have a negative impact on the medication that you're getting from back home. And we've heard that quite across communities, so I just wanted to raise that awareness and raise that importance of, if you are getting medication, make sure you report it. But it's absolutely fantastic, and it's a pleasure to hear all the work that's going on, so thank you very much.
Thank you so much, Jordan. I now take the honor to invite the Chief Officer to come. Charles.
Good afternoon, ladies and gentlemen. Great to see you all, and well done to our 12 ambassadors for the fantastic, work you've done. But even making yourselves available and being part of this, we as an organization, but also as part of your community, we are extremely grateful that you've been able to do that. And as you heard Jordan speak, but also you would have heard, for a very long time before the pandemic, our community was referred to as hard to reach. But what we know is we're not hard to reach. It's the model of engagement that hasn't worked for us. And this is testament to the fact that we can have community leaders, people who are willing to step up, increase their knowledge, and then use it to support people within the community. So we are extremely grateful for that. And I just want to say that your journey hasn't come to an end, because this is a model we want to share up and down the country, and at some point in time when we start our international work, do that overseas as well. So hopefully in the next few months or few weeks, it will be a real delight to have some of yourselves come along to other areas where we're trying to set up similar things. So whether in London, we've just been having a discussion and so we're going to start an APPG on Black Health. And at the launch event, I'm hoping hopefully in October, I need to get sign off from the chair first. I'm hoping we can have some of yourselves coming down, talking about your experience as well. Because what we need is that grassroots movement. As a community, we need to say, we recognize that the health outcomes are poor for us, and we want to change that. Our destinies are in our hands. And that is why having yourselves coming onto this is only the start of the whole thing. And for me, who is a church person, what we say and what we believe is, if one person gets saved, that is more than enough. So just imagine the people you can influence. Our sister spoke about people reducing their fat, oil content, levels or salt, reduction in those things could go a long way to really, have massive impact on people's health and well-being. So massive thanks, everyone, and it's a real delight. And I hope your journey hasn't come to an end. I like the different expertise, including the BAV. You would have many people, whom will come to you, and they will trust you. And it's that trust you have, whether in the church, in your sphere of influence, that is what we want to harness, so that it's not one person being a gatekeeper, but collectively we can influence and have a wider reach. So massive thanks for all you've done. And although certificates are being issued today, I'm hoping that, the team can follow up with some, little tokens or vouchers just to say thanks. And then once again, in a few weeks, we can get together and explore the next steps. Thank you very much.
Yeah, so we'll be calling out the names, and if I call on your name, you just go to the front, Charles, so issue the certificate. So, Jasmine Hassan Bakari. Apologies if I mispronounce your name, bear with me. Okay, the next person is Kalu Hadi Ogoga. Apologies if I mispronounced. Next person is Deborah Wako Tafai. The next person is Ebenezer Fawibe. Next person is Leslie Richard Kofa. Next person is Sarah Obe Ashafa. Sarah. Next person is Angela Oguago. I'm sorry. And next is Michelle Williams. Sorry? Yeah. Right, thank you everyone. I think, can all ambassadors come out for a group picture, please? Just, yeah. Kindly take off your jacket for a bit so we can capture the whole t-shirt. Thank you. Yes, please. So it's time for refreshments and networking. Feel free to greet and meet.